Assalamu alaikum wa rahmatullahi wa barakatuh. I am Dr. Niveen Ahmed Hassan, Professor of Forensic Medicine and Clinical Toxicology, Faculty of Medicine, Tanta University. Our lecture today is asphyxia. What is the definition of asphyxia? It is failure of tissues to receive or utilize oxygen or lack of tissue oxygenation due to interference with mechanism and or function of respiration. How oxygen reach tissues? Oxygen in atmosphere will reach to the respiratory system through respiratory stimulation of the respiratory center to the respiratory muscles to expand the chest, and then oxygen will enter to the respiratory tract from the nose and mouth through the pharynx, larynx, trachea and bronchi, and lastly to the lung. After exchange of gases in the respiratory system, the oxygenated blood will reach the heart. Through the blood will reach to all over the tissues. Classification of asphyxia. We have 4 classifications of asphyxia. The first one is hypoxic hypoxia. The second one is anemic hypoxia. The third one is stagnant hypoxia. And lastly is histotoxic hypoxia. Hypoxic hypoxia is any defect of oxygen in atmosphere or a problem in the respiratory tract where in the external respiratory orifices or in the neck or in the bronchopulmonary tree. Or the problem will be in the mechanism of respiration centrally or peripherally. While anemic hypoxia, the cause will be in hemoglobin. Stagnant hypoxia, the problem will be in the heart or circulation. While histotoxic hypoxia, the problem will be in the tissues itself. The first type of hypoxia or asphyxia is hypoxic hypoxia. As we said, the definition of hypoxic hypoxia is failure of oxygen to reach blood. Why oxygen cannot reach the blood? What is the causes of failure of oxygen to reach the blood? The problem may be in atmosphere, like oxygen lack in high altitude, or presence of irrespirable gases like carbon monoxide, carbon dioxide, or nitrogen, or presence of irrespirable liquids as in drowning. The second cause may be mechanical interference of air passages in respiratory tract or obstructed respiratory tract. Like what? Like closure of external respiratory orifices, which is called smothering. So the definition of smothering is closure of the external respiratory orifices. What are the causes of closure of external respiratory orifices? It may be accidental, like collapse of houses, as you see in the picture, or maybe falling in sands, or it may be violent smothering, violent manual smothering. Another cause which make interference in air passages to the respiratory tract causes in the neck due to closure of internal air passages. The causes may be external, like hanging, ligature strangulation, or throttling. or maybe internal obstruction of the respiratory tract from inside the neck, like foreign body, which is called choking. Choking is presence of foreign body inside the respiratory tract. Or it may be pathological, like laryngeal edema or laryngeal tumor. The cause may be in bronchopulmonary tree, like severe bronchial obstruction as in status asthmaticus. Or the cause may be severe lung pathology, like lung collapse, lung consolidation, hemorrhage, edema, pneumothorax, or pneumothorax. The cause of hypoxic hypoxia may be interference with the mechanism of respiration. Whether the mechanism may be central due to paralysis of respiratory center. What are the causes of central paralysis of respiratory center? The cause may be mechanical, like trauma and hemorrhage, or may be toxic, endogenous toxin like uremia, or exogenous toxin like narcotics, which may produce depression of the respiratory center. The cause may be electrical, due to electrocution, which lead to paralysis also to the respiratory center. Or the cause may be peripheral, due to interference with respiratory movements. What are the causes of peripheral paralysis to the respiratory muscles? The cause may be pathological, due to poliomyelitis, or may be bacterial, like in tetanus, or toxic, as in strychnine and curare, which is muscle relaxant. Or the cause may be electrical, as in electrocution, because electrocution produces severe spasm of the peripheral respiratory muscles, so it will prevent respiratory movement. The cause also may be status epilepticus, or may be mechanical, like in traumatic asphyxia. The second cause of asphyxia, or classification of asphyxia, is anemic hypoxia. In this type of anemic hypoxia, there is decrease in oxygen carrying capacity of blood due to hemoglobin deficiency. Hemoglobin deficiency may be due to hemorrhage or hemolysis, or may be due to lack of functioning hemoglobin, as in case of carbon monoxide poisoning or in case of methemoglobinemia. The third cause of hypoxia is stagnant hypoxia. The cause in stagnant hypoxia will be impaired circulation of oxygenated blood due to shock or congestive heart failure. The last classification of asphyxia is histotoxic hypoxia. The cause of histotoxic hypoxia will be decreased ability of cells to utilize oxygen. Why? Due to paralysis of cytochrome oxidase enzyme, as in case of cyanide poisoning. What are the stages of asphyxia? We have 4 stages of asphyxia. The first one is dyspnea, the second is convulsion, the third is the stage of apnea, and the last one is the final stage. The first one is the stage of dyspnea, which is mean difficulty in respiration. Dyspnea means difficulty in respiration, which is due to deficiency of oxygen and the increase in the level of carbon dioxide. Increase in carbon dioxide at this level, it will lead to stimulation of the brain and the stimulation of the vital centers, including a respiratory center and vasomotor center. Stimulation of the respiratory center will lead to increase rate and the depth of respiration. Rate and the depth of respiration lead to rapid forcible respiration. Rapid forcible respiration lead to increase in the pressure of the alveoli, increase in intra-alveolar pressure, and this increase in pressure will lead to rupture of alveoli. Rupture of alveoli lead to escape of air from inside of the alveoli to outside alveoli beneath the pleura, and so it will lead to appearance of silvery spots. Also, stimulation of the vasomotor center lead to increase in pulse and blood pressure. At this stage, reduced hemoglobin will be increased, and increase in reduced hemoglobin above 5 gram percent lead to appearance of cyanosis, which is bluish discoloration of the skin and the mucous membrane. Second stage of asphyxia is stage of convulsion. At this stage, the cyanosis will be more deep due to increase in the level of reduced hemoglobin. And also, at this level, increase in carbon dioxide will lead to stimulation of the brain as well as stimulation of the motor areas of the brain. Stimulation of the motor areas of the brain will lead to convulsions. So, this stage is called stage of convulsions. Decrease in oxygen and more increase in carbon dioxide at this level, it will lead to more stimulation to the respiratory center, and it is called labored or spasmodic respiration, and also stimulation of the vasomotor center. Stimulation of the vasomotor center lead to generalized vasoconstriction. Generalized vasoconstriction of all blood vessels, including arteries, capillaries, and venules. Increase vasoconstriction of these blood vessels and increase the pressure inside it called congestion. This congestion will lead to transudation of fluids from inside the blood vessels to outside the blood vessels, and this is called fluid transudation, which lead to tissue edema. Another cause of tissue edema also is increased in capillary permeability due to hypoxia. Increase in pressure inside the blood vessels lead to rupture of unsupported capillaries and small venules. And this rupture of capillaries and small venules leading to presence of petechial hemorrhages or tardio spots. Petechial hemorrhages, it is called petechial hemorrhages when appear in skin and the mucous membrane, but it is called tardio spots when appear in serous membrane. The third stage of asphyxia is called stage of apnea. At this stage, more and more deficiency of oxygen and more increase in carbon dioxide. But at this level of increase in carbon dioxide inside the blood, or blood level of carbon dioxide, it will lead to depression of the brain, not a stimulation at the previous stages. No, it will lead to severe brain anoxia or severe brain paralysis. And paralysis of brain means coma, decrease the convulsions and decrease the blood pressure, decrease the heart rate, and also depression of the respiratory center. Depression of respiratory center lead to shallow, slow, and irregular respiration. Shallow, slow, irregular respiration, this is called gasping respiration. And also reflexes will be lost and leading to flaccid muscles. Flaccidity of muscles lead to involuntary discharge of urine, feces, and semen. The last stage is the final stage. At this stage, complete loss of consciousness will appear, also complete paralysis of respiration, which is called kinestoc respiration. Kinestoc respiration means appearance of respiration followed by apnea. Respiration and followed by apnea. This is called kinestalk respiration. At this stage also pupil will dilate and terminal vomiting occurs, but the heart continue to beat for a few minutes. How we can diagnose asphyxia? Diagnosis of asphyxia, it depends on many steps because there is no specific reliable signs for asphyxia. So we will depend on, firstly, taking history, secondly, from the circumstantial evidence, and thirdly, from the autopsy to find the cause of death. It is asphyxia or any other cause. And from full toxicological examination to find it is a toxicological cause or not. And also from the general signs of asphyxia. What are the general signs of asphyxia? General signs of asphyxia including external signs and internal signs. External signs, we will find the face like this, swollen face. The face will be swollen and prominent eyeball, protruded tongue, swollen, protruded, and sometimes bitten tongue. Presence of cyanosis, as we said, which appear in lips, ears, and nails. The presence of froth. This froth will be blood stained, as you see in the photo, and present in the mouth and nostril. What are the cause of this froth? The cause of this froth is mixing of air and edema fluid and the mucus inside the respiratory tract, and also blood from ruptured blood vessels during forcible respiration. This mixing will lead to appearance of froth. Another external sign of asphyxia is appearance of petechial hemorrhage. Petechial hemorrhage is a pinhead size, which appear in the skin, like in the face, especially in very thin skin, like eyelids, forehead, around and behind ears, or appear in the mucous membrane, like sclera, conjunctiva, inside lips, or other mucous membrane. The internal general signs of asphyxia appear in the form of dark and more fluid blood, which coagulate very slowly. Why blood coagulate very slowly in asphyxia? Because asphyxia or hypoxia lead to release of fibrinolysin from capillaries and serous membranes. So increase in level of fibrinolysin lead to more fluidity of blood. Presence of engorged right side of the heart and great veins. Another sign is presence of congested lungs, and also cut section or cut surface lead to oozing of blood-stained froth, beside appearance of silvery spots and tardieu spots. Also presence of congestion and froth in the other parts of the respiratory tract, including bronchi and the trachea. Other internal viscera, it will be congested except the spleen. Why spleen not congested like other viscera? Because spleen is the only organ which contract during asphyxia. Petechial hemorrhages present inside in the internal organs and also under serous membranes, as we see in these photos, present in the kidney tissue and also in the intestine. Present presence of petechial hemorrhage is a non-specific sign of asphyxia. Why? Because it can present in another diseases like congested heart failure. It can present in another diseases like congestive heart failure. It also present in a case of asphyxia called postural asphyxia, which is a type of asphyxia due to a change in the position of the body. Cyanosis also is not a specific sign of asphyxia. Why? Because it can present in another causes like obstructive lung disease, and also visceral congestion is not specific because it can present in other conditions like congestive heart failure and also edema. It is a non-specific sign. One of the signs of asphyxia is engorgement of the right heart, fluidity. We will study also the violent types of asphyxia. Violent asphyxial death meaning mechanical interference with respiration, leading to fatal oxygen lack. What are the types of violent asphyxia? The types of violent asphyxia here in forensic medicine is drowning. The second type is violence to the neck. Violence to the neck may be due to hanging or strangulation or throttling. Another type of violent asphyxia is suffocation. What is suffocation? Suffocation is asphyxia due to other causes, due to causes other than hanging, strangulation, throttling, or drowning. Like what? Like smothering, like shocking, and like traumatic asphyxia. The first type of violent asphyxia is hanging. What is the definition of hanging? Hanging, as we said, it is a type of violent asphyxia. It is a type of violent asphyxia. Due to what? Caused by suspension of the body by a ligature around the neck. So the suspension of the body is important. Violent asphyxia caused by suspension of the body by ligature around the neck. So the constricting force here in hanging is the weight of the body. The weight of the body is very important as a constricting force around the neck. While ligature strangulation is type of violent asphyxia caused by constricting the neck by a ligature but without suspension. There is no suspension in ligature strangulation. What are the types of hanging? The types of hanging is according to the position of the body. When the body is completely away from the ground, it is called complete hanging. But when any part of the body touching the ground, like the feet, the lower limbs, any part of the body touching the ground, it will be called partial hanging. And also hanging is divided according to the type of ligature into loop. When the ligature is not touching the neck completely, like in the photo. The note of the ligature is fixed and is away from the neck. It is called loop. But when the note of the ligature is running, not fixed, it is running and movable, it is called running nose. So we have two types of ligature. Loop, when the note of the neck is fixed note and it is away from the neck. But when the note is movable and running, it is called running nose. What are the mechanisms of death due to pressure around the neck? Pressure around the neck lead to cerebral anemia due to pressure on the carotid artery. lead to cerebral anemia, and also cerebral congestion when the pressure appear mainly on carotid, mainly appear on jugular system. So the first mechanism of this is cerebral anemia when the pressure mainly on carotid arteries, and mechanism of this may be cerebral congestion when the pressure mainly on jugular vein. And also another mechanism of this is asphyxia when the pressure is mainly on the respiratory tract, like larynx or trachea. Or maybe reflex vagal inhibition when the pressure mainly on carotid body, which is very rich in vagal supply. The mechanism of this may be a combination of these factors. Another mechanism of this due to pressure on the neck may be injury to the spinal cord. But injury to the spinal cord appears only in a specific type of hanging called judicial hanging. Appears only in judicial hanging. This is a type of judicial hanging like occurred in President of Iraq, President Saddam Hussein. As you see in the picture, congestion of the face. Judicial hanging, the victim will stand on something like table, and then this table will open suddenly, and the victim will fall down through a hole, very deep hole, and due to falling in this hole for long depths, 3 or 4 meters depths, it will lead to fracture dislocation in the cervical vertebrae, and this fracture dislocation, it will lead to transection of the spinal cord, and this is the main cause of death in judicial hanging, is transection of the spinal cord.